Welcome to this online lecture. During this online lecture, I'll provide a brief overview of the difference between normal and abnormal, or normal and disordered behavior, as we continue to explore the concept of what makes behavior disordered and how we understand and conceptualize the concept of psychological disorder. We rely on a variety of criteria to define our concept of disorder. How do we know if a behavior represents disorder? Most importantly, we do not consider or think about the cause of the behavior. It's not actually part of our conceptualization of what makes behavior disordered. We'll talk more about the causes of mental health problems and psychological disorders as we move through the course. But for now, just know that the causes of behavior that we might categorize as disordered are no different than the causes that we might categorize for behavior that we consider normal. A variety of biological and environmental influences combine to give rise to patterns of behavior, both normal and disordered. Instead, our conceptualization of behavioral and psychological disorder rests on a variety of criteria. First, we might consider the relative rarity of a behavior. In other words, we might determine whether or not the behavior deviates from statistical norms. So if a behavior is common or uncommon, that might factor into whether or not we conceptualize that behavior as disordered. However, we cannot rely on that criterion alone. There are many behaviors that, statistically speaking, are quite rare, but do not fit our overall broad conceptualization of disorder. For example, having a very high IQ is something that is statistically rare by definition, but is not a problem, doesn't interfere with life, and in no way, shape, or form sort of conforms with socially what we think of as disorder. So we can't just rely on the notion of whether behavior is common or not. And beyond that, there might be behaviors that are maybe part of the common human experience that do cause problems, do interfere with life, maybe require treatment or intervention. And it might be important for those behaviors, such as social anxiety, to fit into our conceptualization of a disorder. So we can't rely on statistical norms alone. We also consider, when conceptualizing what a disorder is, we consider sociocultural norms for the society, for the individual whose behavior is in question. So one of the questions on the worksheet you completed for class explored a traditional behavior within the Dani people. Those individuals, historically speaking, had a cultural norm of cutting off a segment of their finger when a loved one had died. I think that's a really good example of how our conceptualizations of what is and isn't normal and what is and isn't a representation of disorder differ across culture and across time. Indeed, norms related to grief have changed across time within that culture, such that that behavior might no longer be considered normal. And that behavior definitely would not be considered normal in modern Western cultures. But again, important to note that our conceptions of what is and isn't normal and what is or isn't disorder changes across culture and is different across culture and is different across time, because a key part of how we conceptualize disorder is whether or not behavior violates sociocultural norms. Another key part of our conceptualization of disorder is whether or not behavior causes personal distress to the individual engaging in that behavior. So one of the examples we explored in the assignment was Sam, who has this strong belief that's disconnected from reality about aliens disguised as humans occupying top positions within the United States government and controlling covertly world affairs. This behavior definitely violates sociocultural norms. It's statistically rare. But in order to sort of fully fit with how we conceptualize disorder, behavior also needs to cause an individual distress or, moving down this list, cause interference with life or impairment, or in some way increase risk of harm to the self. And really, it's these two things that characterize a psychological disorder: violation of sociocultural, or as we'll talk about in a moment, developmental norms, and impairment and interference with life or increasing risk of harm or causing distress. So our conception of a disorder is sort of these two pieces. So more formally, this is how we define psychological disorder. Psychological disorder involves a pattern of behavioral and psychological experiences that causes personal distress, interferes with life, or increases risk of harm to the self, and that violates developmental or sociocultural norms. Another one of the examples that you explored in the assignment you completed in class was Alex, a young boy who had become very distressed when left in the dark at night. But that behavior, although it causes Alex personal distress, is wholly within developmental norms. It's normal in emotion regulation development for children to struggle with fear, such as fear of the dark, become very distressed when encountering those fears, and to only slowly work through how to regulate those emotional experiences. So our conception of psychological disorder is a twofold conception. We conceptualize disorder as involving behavior that violates norms and that causes problems for a person's life. And when behavior does both of those things, we call that psychological disorder.